in which this nerve is emerged. Which nerve? Is the hypoglossal nerve. Posterior to this olive, I mean this region, we call it retro-olivary sulcus, in which 3 nerves emerge, 1, 2, and 3. They are glossopharyngeal, vagus, and the accessory. So, how many nerves emerge from the medulla? They are 4, 9, 10, 11, and the 12, according to rule of 4. Because the first 4 emerge from midbrain, the second 4 they are from pons, and the last 4 from the medulla. Still we are in the medulla oblongata. This picture is posterior. We are cutting here, we are cutting this, the cerebellum, in a half. This is posterior of medulla. This cavity, if you can see it, this is, we call it the 4th ventricle. The 4th ventricle. We want to discuss the dorsal surface here. The lower portion of it form, can you see this elevation? This one and the other. These are fibers or fasciculi. We call them fasciculus cuneatus and fasciculus gracilis. Gracilis and the cuneatus. Both of them. We have here collection of fibers. This one, we call them inferior cerebellar peduncle. Inferior cerebellar peduncle. And the last point, obex. This is the region of obex. We call it the point at which the 4th ventricle form a narrow canal, which is the central canal. The upper portion here form the lower half of rhomboid fossa. This is, still we are in medulla oblongata. We have a transverse section. We have a transverse section through medulla oblongata. Of course, this is the anterior or ventral aspect. This is posterior. How I know this is the posterior? Because there is the 4th ventricle. This is the anterior. In the middle, you remember, this is, we call them pyramids. And lateral to it, this is the olive, here written. And in between, there is a sulcus in which the 12 cranial nerve exit. Right? This is a transverse picture of the medulla oblongata. And you can see there are many nuclei, there are reticular formation here, and there are the medial lemniscus, and so on. Another picture from here down, showing you the brainstem. Midbrain, pons, and this is the medulla. This purple in color is the spinal cord. Just to remind you, pyramid, 12 cranial nerve, olive, and then glossopharyngeal, vagus, accessory nerve, and so on. This is posterolateral of the medulla oblongata. The same description, you can see them. Now, if I want to talk about the pons, bulge, it is bulge, enlarge of brainstem. Rostral to medulla, it means superior to medulla. Ascending sensory tract, descending motor tract, of course, they are fibers. Pathway in and out of cerebellum, it has a connection with the cerebellum. It has a nuclei, concentrated with posture, sleep, hearing, balance, and so on. Which cranial nerve emerge here? Can you see them? 5, the 5th, 6th, 7th, and 8th. According to rule 04, I told you a few minutes before that the cranial nerve, they are 12 in number. 4 of them exit from midbrain, and the second 4